Understanding Canine Distemper, Causes, Symptoms, and Prevention. Distemper. Chapter 1, Introduction, Understanding Canine Distemper. Have you ever heard of canine distemper? This highly contagious and often fatal disease affects dogs worldwide. It can strike suddenly or develop over time, causing severe complications affecting the respiratory, gastrointestinal, nervous, and immune systems. In this video, we will explore everything you need to know about canine distemper, its causes, symptoms, treatments, and most importantly, how to protect your dog from this deadly virus. Chapter 2, What is canine distemper? Canine distemper is caused by the Canine Distemper Virus, CDV, a virus closely related to measles in humans and distemper in wildlife such as raccoons, foxes, and skunks. This virus spreads through direct contact with infected animals through bodily fluids such as saliva, urine, and feces, airborne transmission through coughing and sneezing, contaminated objects such as food bowls, water dishes, and bedding. Once infected, the virus suppresses the immune system, making dogs vulnerable to secondary infections. Chapter 3, Dogs Most at Risk. Any dog can get canine distemper, but some are more vulnerable than others. Unvaccinated puppies are the most at risk as their immune systems are not fully developed. Adult dogs that have not been vaccinated or have weak immunity can also be severely affected. Dogs in shelters or rescue centers are more likely to contract the virus due to close contact with multiple animals. Wildlife exposure increases the risk as infected wild animals can spread the disease to domestic dogs. Chapter 4, Symptoms of Canine Distemper. Canine distemper has a wide range of symptoms which can appear in different stages. The first fever develops 3 to 6 days after infection and may go unnoticed. A second fever occurs later and is often accompanied by eye and nasal discharge, coughing and breathing difficulties, loss of appetite and depression. As the disease progresses, it can cause gastrointestinal symptoms, vomiting and diarrhea, often leading to dehydration, neurological symptoms, tremors, seizures, ataxia, wobbly gait, and paralysis, vision problems, optic neuritis, inflammation of the optic nerve, leading to blindness, hardening of the nose and paw pads known as hyperkeratosis, caused by certain virus strains. Some dogs recover but may develop long-term nervous system disorders, while others may succumb to the disease within weeks. How is canine distemper diagnosed? Diagnosing canine distemper can be challenging, as its symptoms resemble other diseases. Veterinarians typically use physical examination and symptom history, PCR tests, and antibody detection to confirm the presence of the virus, X-rays and blood tests to assess secondary infections or lung damage. If your dog shows any of the symptoms mentioned earlier, a veterinary visit is critical for early detection and management. Chapter 6, Treatment Options for Canine Distemper. Unfortunately, there is no specific antiviral treatment for canine distemper. Veterinary care focuses on supportive treatment, which includes hospitalization and isolation to prevent spreading the virus, intravenous fluids to prevent dehydration from vomiting and diarrhea, antibiotics to combat secondary bacterial infections, medications to control seizures such as phenobarbital or potassium bromide, nutritional support to help the dog regain strength. Despite treatment, the mortality rate remains as high as 50%, so early detection and preventative care are crucial. Chapter 7, Prevention, the key to protecting your dog. The best way to protect your dog from canine distemper is vaccination. Puppies should receive their first vaccination at 6 to 8 weeks of age, with booster shots every 3 to 4 weeks until they are at least 16 weeks old. Adult dogs need regular booster shots every 1 to 3 years, depending on veterinary recommendations. Other preventive measures include avoiding exposure to wildlife that may carry the virus, quarantining new dogs before introducing them to household pets, maintaining hygiene by disinfecting food bowls, bedding, and shared surfaces, avoiding places with high infection risk such as overcrowded shelters with unvaccinated dogs, Even dogs that recover from canine distemper may continue shedding the virus for up to 4 months, so isolation during recovery is essential. Chapter 8: Long-term effects and prognosis. Some dogs that survive canine distemper may recover completely, but others experience lifelong neurological damage. Mild neurological symptoms, such as occasional tremors, which may improve over time. Severe cases, permanent twitching, difficulty walking, or epilepsy. Old dog encephalitis, a rare condition where recovered dogs develop brain inflammation years later, leading to disorientation and behavioral changes. The prognosis depends on the virus strain, the dog's immune response, and the quality of medical care received. Chapter 9: Final thoughts. Canine distemper is a highly preventable but deadly disease. Vaccination is the most effective protection. Early detection and supportive care can improve survival chances. Preventing exposure through proper hygiene and wildlife control is crucial. As a responsible pet owner, staying informed and keeping your dog vaccinated is the best way to ensure a long, healthy life. Thank you for watching. If you found this information helpful, please like, share, and subscribe for more veterinary insights. Let us know in the comments if you have any questions or experiences with canine distemper.